Gentlemen, today we are going to talk about a topic that is quite important for men, but often goes unaddressed. Testicular pain. Yes, you heard me right. Your balls, gentlemen, are not just there for show. They play a vital role in your overall well-being. They produce testosterone, the hormone responsible for muscle growth and that feeling of masculinity. They also produce sperm and regulate the hypothalamus pituitary, which is crucial for reproduction. So, when you start experiencing pain down there, it can be a cause for concern. Now, I know what you might be thinking. You may associate testicular pain with a particular phenomenon called Nofap. For those of you who are unfamiliar, Nofap refers to abstaining from ejaculation for various reasons, and it is true that during this period of abstinence, some men may experience what is commonly known as blue balls. It is a discomfort or pain in the testicles caused by sexual arousal without release. But here's the thing. While blue balls can be a common occurrence for those practicing Nofap, it is essential to consider other potential causes for testicular pain, as it may indicate a more serious underlying issue. So, let's dive deeper into the subject and explore the symptoms of testicular pain. Now, you might be thinking, do we really need to discuss symptoms? Is not the pain itself obvious? Well, my friends, the pain can actually vary depending on the cause. It could be a sharp pain resulting from a sudden injury or a dull ache that worsens over time due to an inflamed epididymis. In some cases, testicular pain can even be linked to kidney stones, causing pain in the back that spreads to the testicles and penis. But it is not just about the pain itself. There are other symptoms that can accompany it, such as swelling, problems with urination, nausea, fever, and even bruising. These additional symptoms can significantly affect your quality of life and should not be ignored. Now, let's get to the heart of the matter. Why does testicular pain happen? Well, there are numerous potential causes, and blue balls from Nofap is just one of the less serious ones. For instance, testicular pain can occur due to an injury sustained during sports or other physical activities. Another condition called epididymitis, which is the inflammation of the tubes in the testicles that carry sperm, can be quite painful and lead to swelling. Hydrocele, the buildup of fluid around the testicles, and varicocele, clumps of enlarged veins near the testicles, can also cause discomfort and pain. In more severe cases, testicular torsion, a twisting of the testicle that cuts off blood supply, or kidney stones that get stuck in the urinary tract, can lead to excruciating pain. It is worth noting that men of any age can experience testicular pain, so it is not limited to a specific demographic. Now, let's address the specific condition often associated with Nofap. Blue balls, or as it is medically termed, epididymal hypertension. This is the pain that many guys refer to when talking about testicular discomfort during their Nofap journey. When a man becomes aroused, blood rushes to the penis and testicles. If a man remains aroused for an extended period without ejaculation, he may start feeling an ache in his balls. It can be quite frustrating to deal with, but here's the good news. Blue balls are not dangerous. Once the erection subsides, the pain should go away as well. It is simply a result of increased blood flow to the genitals. Some men may notice a mild blue hue in their testicles, but it is not always the case. If the color becomes deeper blue or purple, it could indicate testicular torsion, which requires immediate medical attention. So, it is essential to differentiate between blue balls and more serious conditions. Now, how can you determine if your testicular pain is due to blue balls or something more serious? The best course of action is to consult a medical professional, such as a urologist or nephrologist, who can accurately diagnose the cause of your pain. They will ask you questions about the duration and intensity of the pain, as well as your sexual and surgical history. Additionally, they may conduct blood and urine tests to rule out infection as a potential cause. If you notice a lump in your testicles or experience lower back pain, an ultrasound might be recommended to check for testicular cancer. Remember, it is always better to consult a doctor instead of relying on self-diagnosis. Now, let's talk about coping with testicular pain. This can be quite challenging, especially when one of the common remedies for blue balls is ejaculation. However, if you're on a Nofap journey, that may not align with your goals. So, what can you do instead? Here are a few coping strategies you can employ. 1. Distract yourself. Engage in activities that take your mind off the arousing thoughts. Go for a walk, read a book, or play a video game. Eventually, the arousal will subside, and so will the pain. 2. Take a cold shower. Cold water can help restrict blood flow to the genitals and alleviate the discomfort. Alternatively, you can use an ice pack or a warm compress with a fabric barrier to soothe the pain. 3. Over-the-counter pain relievers. If the pain becomes intense, you can consider taking over-the-counter pain medication such as ibuprofen, following the recommended dosage. 4. Wear proper underwear. Opt for breathable undergarments that provide adequate support and help keep your genitals cool. Avoid tight underwear that traps heat. 5. Lay down. Lying down can help redirect blood flow away from the testicles and provide some relief. 6. Cardiovascular exercise. Engaging in cardiovascular exercises can help redirect blood flow to other parts of your body, reducing testicular pain. Now, it is important to note that some individuals choose to ejaculate without pornography as a means to relieve blue balls, and if your Nofap challenge permits masturbation without porn, there's nothing inherently wrong with that. Each person's journey is unique, and it is essential to find a balance that aligns with your goals and values. But here's a question you may be wondering. When should you see a doctor if you have blue balls? The short answer is, typically, you do not need to rush to the doctor solely for blue balls. However, if the pain persists even after arousal, or if you experience intense pain that hampers your sexual performance, it is time to seek medical attention. Additionally, if you notice any lumps in your testicles or experience lower back pain, it is crucial to consult a doctor, as these symptoms may indicate a more serious issue. Now, would not it be better if you could prevent testicular pain from occurring in the first place? Absolutely. So, let's explore some long-term habits and lifestyle changes that can help you prevent testicular pain, especially during your Nofap journey. 1. Regular exercise and physical activity. Engaging in regular exercise not only promotes overall health but also improves blood flow throughout your body, including to your testicles. Exercise encourages the growth of blood vessels, leading to better circulation. 2. Pelvic floor stretches. Some studies have shown that chronic testicular pain may be linked to a weak pelvic floor. Incorporating pelvic floor stretches into your routine can help strengthen these muscles and potentially alleviate pain. 3. The 6th Tibetan Rite. This is a breathing exercise that involves a stomach vacuum technique. It has been suggested that this exercise can help improve blood circulation and potentially reduce testicular pain. For detailed instructions, refer to the end of this post. 4. Proper hydration and nutrition. Maintaining proper hydration and consuming a diet rich in nutrients can improve circulation. Foods such as pomegranates, onions, beets, fatty fish, citrus fruits, and spinach are known to have beneficial effects on blood flow. Remember to stay well hydrated as well. 5. Managing sexual energy and urges. Be mindful of the stimuli you expose yourself to. Sometimes, something innocent you saw earlier in the day can unexpectedly trigger an urge later on. Practice managing your sexual energy through transmutation techniques before it becomes overwhelming. 6. Practice meditation. Meditation is a powerful tool for managing sexual energy and enhancing mindfulness. It can help you channel your sexual energy in a productive way and maintain better control over your urges. 7. Stay productive. Engaging in productive activities keeps your mind occupied and prevents it from fixating on sexual thoughts. Productivity can also serve as an excellent form of sexual transmutation. These lifestyle changes not only align with the principles of Nofap but also promote a healthier and more balanced life overall, reducing the chances of experiencing testicular pain. Now, before we conclude, let's address a few frequently asked questions related to Nofap and testicular pain. Can not ejaculating harm your body? Barring serious health issues, abstaining from ejaculation will not cause any harm. There are misconceptions that semen can build up and cause pain or negatively impact testosterone levels, but these claims are not necessarily true. Temporary discomfort from increased blood flow during arousal without released blue balls subsides once the blood disperses. How do I get rid of testicle pain? First and foremost, you need to determine the underlying cause of your pain. Consulting a doctor is highly recommended. If it is determined to be blue balls, you can try the following approaches. Distract yourself to diminish arousal. Apply an ice pack with a fabric barrier to your testicles for 10 minutes at a time. Wear supportive underwear. Consider over-the-counter pain medication. If the pain persists or worsens, seeking medical advice is advisable. When should I seek medical help? You should call a medical professional if the pain becomes severe and unbearable. Do you notice any visible changes in your testicles or scrotum? There is significant swelling. The painful urination or increased frequency of urination occurs. You experience kidney pain. There is blood in your urine. To recap, blue balls or epididymal hypertension refers to testicular pain resulting from sexual arousal without ejaculation. It is a common experience for those on their Nofap journey and, generally, it is not medically serious. However, it is crucial to differentiate between blue balls and more severe conditions that share similar symptoms. Always consult a doctor for an accurate diagnosis instead of self-diagnosing. While ejaculation can offer quick relief from blue balls, it may not align with your Nofap goals. Instead, employ coping strategies such as distraction, cold showers, over-the-counter pain relievers, proper underwear, and practicing cardiovascular exercise. Remember, it is essential to consult a doctor if the pain persists or if you notice any lumps in your testicles or experience lower back pain. Lastly, preventing testicular pain is better than dealing with it. Incorporate regular exercise, pelvic floor stretches, the 6th Tibetan Rite, proper hydration and nutrition, effective management of sexual energy, meditation, and productivity into your lifestyle to reduce the chances of experiencing testicular pain. Stay strong on your journey, gentlemen. Take care of your precious family jewels and prioritize your overall well-being. Thank you for being a part of this discussion today.